I'm very pleased to introduce our speaker for today. So we have C. Elizabeth Daugherty as our facilitator for today. And a little bit about Elizabeth. Elizabeth is a clinical social worker and educator with extensive experience supporting children, youth, and adults facing serious illness, uncertainty, and grief. And so after specializing in palliative care at the largest cancer treatment center in Canada, she started a community-based private practice supporting individuals and families of all ages following the diagnosis of a complex illness. Elizabeth collaborates on multiple initiatives advocating for greater access to high-quality palliative and end-of-life care, including grief and bereavement support, and she teaches courses, seminars, and workshops across disciplines, settings, and sectors. Elizabeth is also honored to be a partner with the Children and Youth Grief Network and is thankful to be contract teaching faculty at the Lyle S. Hallman Faculty of Social Work at Wilfrid Laurier University and is truly grateful to be an assistant clinical professor adjunct with the Department of Family Medicine, Division of Palliative Care at McMaster University. So with all of that being said, I'm very pleased to pass it over to Elizabeth for the rest of our presentation.
Thanks so much, Vinitha. How's the sound?
Good. And thank you for reminding me. Just another note. So this is just an audio presentation. So you won't be seeing Elizabeth on video, but if you do have any problems hearing her audio, feel free to just let us know. There is the chat feature at the bottom. Just if you can't hear her, feel free to let us know. We'll try to troubleshoot that, but it's just an audio presentation and you should be seeing just her slides on your screens.
Okay, thanks for saying that, Vinitha. So hello, everybody. Thank you so much for joining us today. And yes, as Vinitha has mentioned, this presentation is on demystifying grief and loss in the face of uncertainty. Tall order, indeed. And certainly this is a brief presentation. So I simply wanted to mention a few things as I start. I will be sharing information, and the information that I have really is informed from my work across settings and sectors, from working at the largest cancer treatment center in Canada to working in the community. And I've worked with people of all ages, from kids and teens of all ages to adults of all ages, from time of diagnosis with a complex illness throughout their illness experience as they face numerous losses, but also as people face and experience post-traumatic growth. With that being said, I recognize that each and every experience is absolutely unique. And with that being said, I would never profess to be an expert in any way or shape or form. And in saying that, I will never speak for the experience of another. I believe that people are experts in their own lives. And with saying that, I have learned that I am a lifelong learner, that all of this is simply a process about showing up and about being open to the questions. So in fact, today I might offer you more questions than answers. So I simply wanted to put that out as a starting point. A lot of the information I'm going to be sharing with you today is actually part of a different presentation I put together for the Canadian Cancer Society as part of their Cancer and COVID-19 webinar series. I mentioned this because certainly if you want to take a look, if you haven't already done so, the Canadian Cancer Society, of course, has a range of free resources and supports for people across Canada, whether you've been diagnosed with cancer or someone you love has been diagnosed with cancer. You know, whatever part of the experience you're facing, the Canadian Cancer Society has free resources and supports for you. And as part of this webinar series, there's information on COVID and cancer treatment, on staying safe in the context of all of what's happening right now. There's also a webinar on coping and strategies of coping with cancer in the midst of COVID. Also a webinar on reducing risks, considering exposure. So there are more webinars to be posted, more webinars to follow, but I simply wanted to mention this as a starting point, that these resources are available for free. I'll also later on in the presentation mention another resource I highly recommend as well from the Canadian Cancer Society. So, excuse me, moving forward. I mentioned this. CMHA stands for the Canadian Mental Health Association. I mentioned this as a starting point really to frame all of this. The Canadian Mental Health Association talks about this. And actually a recent survey that they conducted of Canadians said that roughly 77% of Canadians right now, when asked, how are you doing, really respond, I'm fine, thanks. And what they really mean is, I'm not feeling like myself right now, or I'm worried about my family's health, or I'm worried about what's going on with my work, or I'm really not coping and I need someone to talk to. The reason I mention this as a starting place is that the Canadian Mental Health Association, like the Canadian Cancer Society, also has a range of free resources and supports for anyone, whether you've been diagnosed with cancer or someone you love has. You know, whether you're facing a new diagnosis, at any experience throughout the cancer journey, but certainly for those people that are facing bereavement, the Canadian Mental Health Association has free resources and support, including peer support. Because as mentioned in that recent survey, roughly 77% of Canadians are saying, I'm fine, thanks, when they're feeling anything but fine. So I simply wanted to draw your attention to this as another resource you can access online. So the starting point. So for today, certainly, yes, this busy intersection is certainly something that maybe many of us haven't seen in some time, although in light of what's happening in the news today, we appreciate there's lots crossing and intersecting, certainly in the face of cancer, certainly in the face of COVID, and all of the loss and trauma that's being witnessed now. It's also important to recognize, though, that wherever you are, wherever you're at in your experience, that we arrive at this space or this place, the way we get to this place, this intersection, is a unique journey for everyone. And while some people might have access to resources or supports or family, there are many others who have the absence of all of that. So certainly it's a gentle reminder that arriving to this place looks different for everyone, and that many face barrier after barrier, whereas others might have access to support and resources. So recognizing arriving at this place, this intersection, looks different for everyone. And that one word, cancer, that one word means so much to so many and reflects millions of stories, millions of outcomes. And that while many people say, I understand, I know exactly what you're going through, the recognition that this journey, this experience, looks different for everyone. It's without making assumptions. It's about being open to listening, to better understanding, to learning about the experience of others, and also looking at how we share our own experiences, accessing support or resources as part of this experience. But more than anything, yes, it's one word with millions of stories, but what does this one word mean to you? Certainly looking at what this experience means for you. And again, whether you've been diagnosed with cancer or someone you love has, whether that person is going through treatment, has finished treatment, whether that person is facing end of life, or whether that person is dying or has died, and you are living in the face of bereavement, missing that person after they've died. What does this experience mean for you? I think all of this is recognizing that you are, as a whole person, it's looking at mind, body, and spirit or soul. I mean that in the most non-denominational way and the most respectful way possible. That certainly when we look at an illness like cancer, quite often, it's really the physical impact that people explore. And for people themselves diagnosed with cancer, or really any complex illness, the impact of that illness on their mind and their spirit is often overlooked or minimized. But certainly, if it's someone you love that's been diagnosed with cancer, what does it mean for you? The physical impact, the mental or emotional impact, or the spiritual or practical impact. All of this, again, in the context of COVID, what does this experience mean for you as a whole person? How is it impacting you? Certainly what we know is it means living with added uncertainty and added isolation. For many people already on the cancer experience, from diagnosis throughout, it means not knowing what to expect quite often. Not knowing how they might be feeling through treatment, not knowing maybe how they might be able to manage the side effects, not knowing what to expect. Certainly for many people, I hear all too often, I worry and I wonder if it'll come back. Wondering how they might cope, they might respond. Again, certainly anyone facing a cancer diagnosis throughout their experience lives with uncertainty and indeed lives with isolation. And that was all too true before COVID happened. But certainly now it adds to an added layer of complexity, an added layer of uncertainty, and added isolation. What will this mean for treatment? What about next steps? What resources are available? Where can you turn for support? So all of this means living with added uncertainty and isolation. So how do you move forward? I think certainly, again, recognizing, much like I pointed out at the beginning, this journey is different for everyone. Certainly in how we've all arrived at these places and spaces, but also how we move forward, speaking to our own needs and unique interests, our abilities, but also our access to resources and support. This journey looks different for everyone. So I think more than anything, it's about what this journey, what this experience means for you. And to really get to the heart of that, it means looking or exploring below the surface. And this is from a resource that I use a lot in the work that I do with kids and teens, but expressive arts are relevant for people of all ages. And so this is from an organization called Art with Heart. And this is really asking to go below the surface. So again, coming back to that Canadian Mental Health Association study where they said 77% of Canadians said, "I'm fine, thanks." How about diving below the surface? What's underneath that response? "I'm fine, thanks." You know, so again, asking you to dive below the surface. What's true for you? And certainly, if it's someone you love that's been impacted by cancer or any serious illness, what's below the surface for them? Again, while many people might be inclined to say, "I'm fine, thanks," what does this look like for you? And what does that look like for the people you love? So I simply ask you to dive below the surface. Again, recognizing what's true for you. What does this impact look like or feel like for you? I think it all starts with acknowledgement, and certainly acknowledging the isolation and loss that are so prevalent as part of a cancer experience anyway. One of the most common concerns I hear from people after they've been diagnosed with cancer, whether the person's been diagnosed themselves or whether someone they love has been diagnosed, and certainly throughout the cancer experience, at end of life and into bereavement. One of the most common concerns I hear from families or from individuals is when people say, you know, people that I thought might be there to support me, might be there to check in, have stopped calling or stopped texting. They're not checking in, they're not calling. I thought that they might be there to offer support. So for many people, that isolation and loss is already so prevalent in a cancer experience, and it's only compounded now in the face of COVID. That isolation and loss is so real. So it really means starting with acknowledging the isolation and loss. So this is that image of that elephant in the room. And the elephant is saying, "I'm right there in the room and no one even acknowledges me." For many people, they don't acknowledge the impact of isolation or even identify the range of losses they might be experiencing. Certainly in the context of cancer, for many people following a diagnosis of cancer, the range of losses that happen are also important to acknowledge. For many people I meet, they talk about carrying this weight or not understanding why they're coping and not really realizing or acknowledging the range of losses that they're carrying or experiencing and not having named them. Certainly as well, coming back to the isolation, many people feel like that elephant in the room after they've been diagnosed with cancer, or someone they love has been diagnosed with cancer, or when someone has advanced cancer, or after someone dies. People often say that they feel like that elephant in the room, that they feel like people avoid them or step back or step away for fear of not knowing what to say. That itself is a loss. So, speaking of loss, I wanted to highlight this definition because I believe this is really important and often not talked about as part of the cancer experience. This is from Dr. Kenneth Doka, a researcher and clinician. And he talks about the fact that grief is a reaction to loss. And although we often confuse it as a reaction to death, it's really just a very natural reaction to loss. When we lose any significant form of attachment, I'm going to repeat that again. When we lose any significant form of attachment, grief is the process of adjusting. So certainly, while grief is often confused as a reaction to death, think about how loss and grief might be part of your lived experience thus far to date. What forms of loss have you experienced in the absence of a cancer diagnosis, in the absence of a cancer experience? There are so many, because it is indeed loss and grief are a natural experience a universal experience, in fact. But then again, grief is that process of adjusting to loss. So again, I ask you to consider losses you've experienced. And although this isn't often talked about, so often there's so much of a focus on treatment, that in the cancer experience, loss isn't often explored until someone's facing end of life. So I simply mention this to consider, what losses have you experienced to date, completely unrelated to the cancer journey? How have those losses been acknowledged, and have they been grieved? Or are you grieving those losses? Again, thinking about attachment. But also in the face of cancer, what other losses might you have experienced? And certainly in the face of COVID, there have been multiple additional losses that people have experienced. I simply ask, what does this mean for you? And again, that can be multiple losses, whether in the face of COVID, whether that's job loss, income loss, food insecurity, just to name a few. Certainly there's a loss of ritual and physical connection to whether it's colleagues or friends or family. But in the face of cancer, there are so many more that often don't get named. So I'll speak about that a little bit more. But I wanted to highlight this as well. Secondary losses. Yes, there's more. And what is a secondary loss? The reason I mention this is because a secondary loss is related to and following the initial loss. So for instance, for someone who's going through cancer treatment, they might have chemotherapy, and they might, because it doesn't happen for everyone, but they might have the experience of losing their hair, which yes, is indeed common for many people. But what does that mean when someone loses their hair? Well, for many people that I have met, it has meant an incredible loss of self-esteem, a loss of identity. So those secondary losses can be related to something like losing your hair through cancer treatment. Could be a loss of intimacy, or a loss of social connection, a loss of confidence, among others, to say the least. As well, fertility is also something that is a tremendous loss in cancer treatment for those that have that experience. So again, thinking about the impact of secondary losses as it relates to fertility. So some of these losses, these secondary losses, may be temporary, where others may be permanent. It's important to recognize what these secondary losses are, and noting that these secondary losses can have physical, emotional, mental, spiritual, and practical implications. Thinking about what this might look like or feel like for you or for the people you love. It's also important to know that these losses, like a ripple flowing outward, will impact each person in a unique way. And this can be especially challenging in a single family, where the impact of those secondary losses looks and feels different even within a single family. It's not the same for everyone. But more than anything, starting with, what does this look like for you? And being open to learning what it looks like for others. Because again, as I've already spoken to, isolation is so common following a diagnosis of cancer. Coming back to that idea of the elephant in the room, many people talk about the experience of isolation, and that's certainly compounded now in the face of COVID. Certainly what I've learned in my work is that while many people, worry about saying the wrong thing, or might not reach out because they're worried they're going to upset the person, they're worried about what it means for their own health or well-being, and it's scary. Certainly what I've learned in my work is that it's simply about showing up, even if you don't know what to say or do, being yourself and not being afraid to care, trying to address that isolation. But coming back to this for a moment, because it is so unique for everyone, it's looking at, what does this mean for you? And again, coming back to the concept, and it's more than a concept, that you are a whole person, mind, body, spirit, without judgment. What do you notice? What is the mental impact of this experience for you? Some people talk about difficulty focusing, where others might have, the experience of ruminating or really focusing on details or facts or experiences again and again and again, where they get stuck. Physically, it's also important to notice what your body feels like, head to toe. What are you noticing? What's true for you? Emotionally, again, some people have a range of emotions that they experience. Others might get stuck. What does this look like or feel like for you? And when I speak about spirituality, I mean this again in a non-denominational way. Spirituality can mean religion, or it can mean, anything beyond religion? Where do you find and make meaning? What does that look like and feel like for you? And what is the practical impact across all of these domains for you? So again, exploring the impact of uncertainty and loss in your experience, I say without judgment, because there are so many opinions that can really harm one's process of healing, of moving forward. I simply ask that you begin with starting with yourself. What do you notice mentally, physically, emotionally, and spiritually? What's the impact for you? You are the best barometer to know what the impact is, and then taking time to notice, how can you respond? What are the next steps? I wanted to mention this, again, I mentioned Dr. Kenneth Doka earlier. This is from Doka and his colleague Martin, talking about the ways in which we metabolize loss and grief. I wanted to mention this again because it comes to the way people cope individually. And there are differences and there are similarities. I simply mentioned this to raise awareness, to shine a light on this. Ask to see, where do you see yourself in this, and where might you see the people you love? So, intuitive grieving is one of the things that Doka and Martin speak about. And intuitive grievers are people who will inherently metabolize an experience through being. So these are people that primarily seek out emotional or spiritual outlets. These were people that would prefer to connect with someone eye to eye. So people who are intuitive grievers are likely open to talking to a friend or a family member or a colleague or even a counselor or peer support. They'll be able to sit down and metabolize through that emotional or spiritual outlet by being with someone eye to eye. And these people can metabolize their grief and integrate their grief and their emotions and meaning making by being eye to eye with someone, intuitively grieving in that way. Now, conversely, and I say this without judgment, I often refer to it as like being right-handed or left-handed. Instrumental grievers, think of instrument as a tool. Instrumental grievers metabolize through doing. These are people who primarily seek mental or physical outlets. Think reading or researching, or physical could be running, hiking, yoga, building something, whatever it might be. Instrumental grievers prefer connections shoulder to shoulder. Again, some people might be most comfortable talking as they're driving in a car. Or people who are instrumental grievers might be comfortable sitting in an information session, but not so comfortable sitting eye to eye, one-to-one with a counselor. Instrumental grievers are also comfortable back to back. So really it's not that intimate eye to eye contact, that sense of deep vulnerability, having to process and metabolize that way. Instrumental grievers integrate their grief through thoughts and actions. So the reason I mentioned these two, and again, recognizing there is a continuum between these, simply asking, where do you see yourself in this experience? And where do you see the people you love? Because all of this is about recognizing your strengths, responding to your strengths, and then turning to those areas and spaces that nurture you and nourish you, recognizing that sometimes even within single families, you might have an intuitive and an instrumental griever as partners. And it means responding to their unique strengths and unique supports, speaking to their needs. And sometimes quite often, that creates tension or conflict when someone says, why won't they talk to me? I think it's recognizing where you land, what you need, and how you can respond for yourself, but also for the people you love. It's also recognizing that all of this is a process, and while many people hear about stages and steps, this is not a linear process. I mean, this graphic has been around quite a lot, and I like it for the very reason that it speaks to the fact that this is not, linear. This is not a place of arriving, and in my experience, that closure is a myth. We close the door in a room, we don't close the door on a meaningful connection, and that's the end of it. That grieving and living with loss is a lifelong process, and as long as we love, we will continue to grieve in new and unique ways. But that it is indeed not a stage or a linear process. And with that being said, I simply wanted to mention as well, this is from Dr. Earl Grolman, as he says, grief is not a disorder, a disease, or a sign of weakness. It is an emotional, physical, and spiritual necessity. Grief is the price we pay for love. And the only cure for grief is to grieve. So what happens for those unnamed losses? What happens for those losses that haven't been acknowledged or can't be acknowledged? How do we grieve those spaces and places that we have yet to speak to, that we have yet to name? The other thing I wanted to mention about this, all of this, again, in the face of cancer, in the face of COVID, it changes our assumptions about the world. And it's important to recognize that when many people say, like, I feel like I don't know who I am anymore, or I don't know where I fit, it's important to recognize that our identity and the many assumptions we hold about our place in the world are threatened in the face of trauma. And I'll speak to trauma in just a minute, and loss. And that depending on the nature of the trauma or the loss, someone's identity can be changed temporarily. And as I mentioned, reflecting on the experience of losing someone's hair in cancer treatment, that may be temporary. Or, as I mentioned, certainly fertility. And fertility loss may be permanent for people following their cancer treatment. What does that mean for your identity? And again, it's important to recognize that while commonalities exist, reactions to trauma and loss are unique for each person. And this is especially true within a single family. What does this mean for you? And what does this mean for the people around you? Now, I mentioned the word trauma, so I simply wanted to speak to it briefly. And again, this is from the Canadian Association of Mental Health. It's important to note that trauma is the lasting emotional response that often results from living through a distressing event. And sadly, there is no shortage of those right now. But that experiencing a traumatic event can harm a person's sense of safety, that a traumatic event can harm one's sense of self, and a traumatic event can harm the ability to regulate one's emotions and to navigate relationships. Coming back to those assumptions about the world, it impairs trust and that sense of safety. But it's also important to note that traumatic events can be really difficult to define, because what might be viewed as traumatic for one person might not be traumatic for another. A big part of this, as we show up for others or as we show up for ourselves, being open to what our experience is and those around us, it's about not making assumptions, but being open to asking questions with humility. I also wanted to mention this, that yes, post-traumatic growth is an important part of this experience. And this is from Tedeschi and Calhoun. And certainly they talk about the fact that traumatic events are in no way viewed as desirable. But what is helpful is stories of others moving through trauma not only reduces isolation and offers hope, that connecting with others, especially now in a time of so much isolation, that it's connecting with the stories of others that can offer hope. And it's also important to note that strength is often correlated, ironically, following an increased sense of being vulnerable. Let me repeat that again. Strength is often correlated with being vulnerable. So that's important because it speaks to this. Now, I often talk about Dr. Brene Brown, and not just because she's my social work superhero, but because she has a couple of lectures that I always highly recommend. I often talk about TED Talks. Now, just a moment ago, I talked about hearing the power of stories, hearing the power of others' voices. TED Talks are free lectures you can actually see online, and you can actually look at lectures on absolutely any topic you can possibly imagine. They're all available for free online. I simply mentioned Dr. Brene Brown because she has two that I think are so salient and so relevant to the cancer experience in the face of uncertainty. And so one of her TED Talks, I recommend them both. And again, I've highlighted TED there for you. Her first TED Talk is on vulnerability, and her second is on shame and guilt. All of those issues are so prevalent as part of a cancer experience, wherever you find yourself, whatever that might look like for you. But Brene, in her research, certainly has demonstrated that vulnerability is not weakness. And that myth is profoundly dangerous. And vulnerability, as she has demonstrated, is actually the birthplace. Again, it's about taking risks, being open, being authentic, being truthful, being honest. Vulnerability is the birthplace of innovation, creativity, and change. So why do I mention this? Because more often than not, what I hear from people is they are so tired of being told to be brave and be strong. And what that means is it dismisses or minimizes the range of their experience when fear is so real, sadness is so real, anxiety is so real. That whether this is following a diagnosis throughout the entire cancer experience at end of life or into bereavement, I can tell you almost universally, the first thing people say to me when they cry in my presence is they apologize and say, I'm sorry, and they immediately try to shut it down. The burden of being brave and strong. Again, this is a unique journey for everyone. And I simply say that whatever resonates for you is important. But the quickest way to shut down someone's emotional expression or speaking to their experience of vulnerability is to tell them to be brave and stay strong, because that doesn't leave room for vulnerability. So simply ask you to consider what that looks like or feels like when you've been told to be brave and stay strong, because to be anything but brave means that you're scared or weak. So what does that mean to simply be vulnerable in the face of all of this, and that being told to be brave and strong can indeed be a burden? All of this is simply about finding your way. And I know that many people offer what they can in the hopes of being able to fix or cheer someone up out of their experience. And in the words of Megan Devine, who is a writer who writes about her own experience of loss and grief, her book is titled, It's Okay That You're Not Okay, Meeting Grief and Loss in a Culture That Doesn't Understand. All of this is about finding your way. As a starting point, it's about leading with compassion. And I had the privilege of meeting the founder of narrative medicine at Columbia University, Dr. Rita Sharon. She shared this quote, and it stuck with me ever since. This quote from Van Gogh saying, I'm always doing what I cannot do yet in order to learn how to do it. I'm always doing what I cannot do yet in order to learn how to do it. All of this is a process. You know, in my opinion, there's no perfect. It's simply about showing up and doing the best you can. And for so many of these experiences, it's not actually about having answers, but being open to the questions. So starting with compassion for yourself, for others around you. And for many, you know, they might say, I'm not sure what to say or how to say it. I wanted to highlight this quote, that caring is the privilege of every person. Specifically that, yes, our society suggests that caring and living are quite separate, and that caring belongs primarily to professionals who've received special training. And yes, as one of those healthcare professionals who's had special training, I can say that's important. And yes, although training is important, and although certain people need preparation to practice in their profession with competence, caring is the privilege of every person and is at the heart of being human. So it's about how we simply show up, even if we don't know what to say or do. Simply being ourselves and not being afraid to care. Also recognizing that support in any configuration looks different for everyone. Again, coming back to highlight instrumental versus intuitive grievers, their responses, their support will look different. So again, recognizing what that looks like for you on a given day might look different the following week. It's not prescriptive. Support looks different for every person, as do responses in this experience. And again, much like I highlighted at the outset of this presentation, the CMHA survey that said 77% of Canadians are saying, I'm fine, thanks. What's below the surface? Any and all of these experiences are a natural and expected part of the cancer experience, especially now in the time of COVID. It's also the recognition that simply because you see someone who seems happy doesn't mean they're not simply feeling all of these other things as well. Recognizing that responses and those expressions look different for everyone. But coming back to the fact that there is power in acknowledgement. It's not trying to cheer someone up out of their experience or distract them or minimize. For many people, I've heard someone, them been told that when they've lost their hair following chemo, don't worry, it'll grow back. Or, so you can't have children, but maybe you can adopt, don't worry. Again, there's power in acknowledging the loss. There's power in acknowledging someone's experience. And as Megan Devine also says, some things can't be fixed. They can only be carried. But to say all of that, it's recognizing that communication is an essential tool. And we know that anxiety can build when we don't know what to expect. So how do we explore ways to access information, access support, access resources that speak to our unique needs? It comes down to communication. Who and what is important to us? And how do we connect with those facts, those details from credible, informative places? It's really about beginning the conversation. I like to share this image simply because a lot of the work I do with parents, quite often they'll say, well, my kids don't know. Just to be really clear, I've worked with kids as young as 2 and 3, that are very aware and their parents haven't said a word to them. I also want to mention that some of these parents I've worked with are in their 80s and 90s, and they have said, I haven't told my kids, they have no idea. So recognizing that a parent with any child, that kids, regardless of age, whether they're 2, 12, 22, 42, or 62, the people we love, the people we're around, pick up on nonverbal cues, whispered conversations, changes in behavior. And certainly for many people, if they don't have access to honest, credible information, they will find it out in their own way. And some of those means, those methods might not be credible. And moreover, might not speak to your unique experience. So like this graphic says, this child in between the two parents is saying, let's see if Siri can tell me the secret word you're spelling. How do we begin the conversation recognizing that communication is an essential tool as we move forward in this experience? So I wanted to share some conversation starters. I often refer to these as the 3 W's. And whether this is speaking to your own experience, whether you're wanting to explore with someone you love, or whether you're wanting to get a better sense of what someone you love is thinking. Wonder, worry, and wish. Asking what someone is wondering about explores questions that they might have about their experience. Now that could be, I wonder if treatment is going to be on hold. I wonder what the side effects might look like. I wonder how long it'll be before my hair grows back. I wonder what I'll be feeling like. It's also the opportunity to explore questions you have about someone's experience. I wonder what you're thinking, or I wonder how I might be able to help. Asking someone what they worry about. It's also exploring fears they might have. Someone might be worried, of course, that the cancer can't be cured or the cancer might come back. But they also might worry that they might not be able to do something that's meaningful for them because of the way they'll be feeling because of treatment. It could be any possible worry. But it's also a way to explore what you might be worried about, sharing that with the person you love, wondering that, sharing that conversation with them, things that you might be worried about. And lastly, wish, exploring hope. Hope is so essential, and hope can be for something big, but it can also be something small. And I've certainly seen all expressions and experiences of hope. So that goes both ways, exploring what hope means to someone you love, but also sharing what hope means to you. And this gets at the point of where do we go from here? So I always come back to this image because this is actually from a group of kids, all of whom had a parent diagnosed with cancer, all of whom had been told that their parents' cancer was curative. So when I simply asked a group of kids, and in this room there were roughly 14 kids from the ages of 4 to 17, I broke them up in small groups and asking them to work in teams, supporting one another, giving them chart paper and markers, asking them to expand on these concepts. I said, what are you wondering about? So this is not my writing. This is a writing of a young girl. And this is what she and the group of kids she was sitting with came up with. So again, this is from a group of children who were told their parents' cancer was curative. I wonder when she's going to be feeling better, if she'll be okay, when this will be over, why this happened, if she'll lose her hair, if she's going to die, how she's feeling, if she's okay to play. So again, talking about how conversations are essential and that communication is an essential part of this, you can see that this is a process, that all of these kids have been told your mom's cancer is curative. But these were questions that they were continuing to wonder about, presenting an opportunity to revisit what they were wondering about and where to go from there. Also asking this group of kids, what were they worried about? And as you can see here, they were worried if their parent was going to die, or if she wasn't happy, she'd be able to drive, if it wouldn't be the same, if she couldn't play. Again, exploring fears is so essential because what can we do to respond to some of these fears? What fears are grounded or not? How can we respond, provide support, resources? And certainly, how can we wonder alongside them? And lastly, asking what you're wishing for. Of course, these kids wish that their parent didn't have cancer and they wish that it would all get better. Also looking, at wishing that their parent would feel better. But as you can see on the bottom left corner, I wish I could do more. Kids can even feel helpless in this experience. So exploring what someone's wishing for creates an opportunity to explore what someone might be holding on to, what they might be wondering about, worried about, or wishing for. Starting those conversations is so essential. And then in turn, remembering that listening is a gift. And I love this quote. This is actually taken from Twitter, from her page. I love listening. It's one of the only spaces where you can be still and moved at the same time. Again, it's not about jumping into fix. It's about creating an opening and listening. And then moving on with that information to explore care, whether it's for yourself or for your family. Where do you go next? And navigating the healthcare system, there are so many moving parts and people and places. And it can be difficult to know where to go next. So much of this is about having informed conversations. And what this looks like in a given family can look and feel very different. It can create added tension, but it's about having informed conversations. Do you have access to people and places to answer the questions you have, speak to the worries you might have, and also explore hope? How do you connect with the resources and supports to have informed conversations? For many people, asking for help can be something that they worry about. Again, thinking about being brave or strong. Also, many people hope that the resources will be offered to them and don't always realize that sometimes it means having to advocate in a time of need. I wanted to highlight this, which is part of my specialty. We often refer to it as person-family-centered care. Why is person and family-centered care important in the context of cancer and, in fact, in the context of any serious illness, whether that's MS or Parkinson's or ALS or cancer? Person and family-centered care is appropriate for any person and or family living with or at risk of developing a complex illness due to any diagnosis with any prognosis, curative or not, regardless of age, children, teens, and adults of all ages. And at any time they have unmet needs and expectations and are prepared to accept care. Person and family-centered care tries to take a proactive approach and really looking to treat all active issues and really doing the utmost to prevent new issues from occurring. It also addresses the physical, psychological, social, spiritual, and practical issues and associated expectations, needs, hopes, and fears, and it is delivered by a team of different disciplines and specialties who are both knowledgeable and skilled in all aspects of caring for a person and family facing a complex illness. So, I like to explain this approach to person and family-centered care and give context to really what is part of my specialty, palliative care. Yes, what I have just read to you is the definition of palliative care, and in fact taken from the Canadian Hospice Palliative Care Association. Palliative care, much like the word cancer, has so much stigma surrounding it and so much misunderstanding. And yes, while hospice care is caring for people at end of life, palliative care, that yes, its roots began at end of life care, recognize that all of these things are true for individuals and families of all ages from time of diagnosis, regardless of prognosis. So, I simply mention this to demystify palliative care because, unfortunately, in my experience, far too often, if people are referred at all, is only at end of life. And what that leads to is incredible, avoidable suffering. So I simply demystify palliative care because there are so many losses that have nothing to do with dying or death along this experience. So if you're curious and want to learn more about palliative care, it is available at every hospital and every cancer center across Canada. And while the teams and the size of the teams looks different from one hospital to another, you can contact the palliative care team or ask your healthcare provider to tell you more. And the reason I mention this advocacy piece, is this comes from a Canadian study that less than 1/4 of Canadian general practitioners and family physicians and nurses are experienced and comfortable talking about planning for illness and end of life with their patients through advanced care plans. So I simply wanted to mention that yes, healthcare providers, I know it's stating the obvious, but as human beings, some aren't comfortable exploring some of these issues. And as standard training and education is available in palliative care to every healthcare provider across disciplines, many don't understand the breadth of it. I simply mention it as a point of advocacy. I highlight this from Dr. Atul Gawande, recognizing that many people have to ask for referrals for additional resources and support. And he's an incredible surgeon from the States, but also a brilliant writer. He says, I think it's a bad sign for us in the medical profession that patients have so much better care when they have the conversation about what the wishes for their care turns out to be, and yet the majority of the time the patients have to initiate the conversation. We've got a long way to go. So again, navigating the healthcare system often means at a time when you're feeling most vulnerable, whether it's newly diagnosed, whatever part of the cancer experience you're on right now, whether it's into bereavement, it often means when you are feeling most vulnerable, you are also having to advocate for care. And that can be difficult when you're trying to find certainty in the midst of all of this uncertainty. These are actually the words of Arthur Ashe, the incredible tennis player from the States, who is not only a tennis player, an incredible athlete, but a brilliant advocate who had the experience of living with a complex illness that was so stigmatized. Arthur Ashe talks about start where you are, use what you have, and do what you can. And this is actually known as the Serenity Prayer, and I mean this in a non-denominational way. Explore what you can control. I think this is a great reminder of that succinctly. Asking to grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. This also means connecting to the present moment. And for many people, when we talk about anxiety, certainly in the midst of a cancer diagnosis, any point in the cancer experience, into grief and bereavement, but also certainly in the face of COVID, that fight, flight, or freeze response, tapping into our sympathetic nervous system. Yes, although we haven't had to run away from dinosaurs, we certainly try to run from threats, whatever that might be. Connecting to the present moment can be something as simple as using something as accessible as your breath. When you feel anxious, simply make your exhale longer than your inhale. And lengthening your exhale or your out-breath actually soothes your nervous system, shutting down that flood of stress hormones that can trigger anxiety within that fight, flight, or freeze response. Making your exhale longer than your inhale soothes the fight or flight response in the nervous system. And focusing on the power of your breath. Now, for some people, they might actually count. Counting in for a breath of 4, and counting out for a breath of 6. Whatever that looks like or feels like for you, focusing on your breath can give you an anchoring moment. The saying, I need to catch my breath, is real, literally and metaphorically. And focusing on that breath, lengthening that exhale, can help you shift from that fight, flight, or freeze response to a rest and digest, or the parasympathetic nervous system. It's one option that's accessible and under your control, connecting with the present moment. And as I mentioned earlier, reflecting on your strengths. And I love this quote from Emerson, what lies behind us and what lies before us are small matters compared to what lies within us. It's also important to recognize that boundaries are so essential in self-care. Again, coming back to yourself as a whole person, thinking about physical, mental, emotional, spiritual, practical. Who and what nurtures you? Who and what do you allow in? And who and what do you need to take a step back from? You are the best barometer for this, that power of acknowledgement, that power of noticing. Boundaries are so essential in self-care. And I also want to mention quality of life, because sadly, quality of life is often not talked about till end-of-life care. This is actually from Dr. B.J. Miller, who actually became a palliative care physician after he became a triple amputee through an accident. He's got a brilliant TED Talk, but he talks about quality of life is not a consolation prize. And I can tell you far too often, I meet people who say, I was planning for retirement and I didn't expect this would happen. Or I was so focused on getting through treatment, I just didn't think about how I was feeling now. Quality of life is important for every single one of us here and now. Consider what it means for you. And consider what healing means from you. This is from David Giuliano, who I've had the pleasure of hearing speak. He's lived with advanced cancer for a couple of decades now, and he talks about the fact that there's a difference between healing and cure. And you can be healed and not cured, but you can also be cured and not healed. Coming back to the present moment, I don't pretend to say for a moment that gratitude will minimize or distract or take away any of the tough stuff that happens in life. It is simply to find and connect with those moments of joy and meaning as a counterbalance to catch your breath in the midst of all of this. Consider what gives your life meaning now. And I often refer to it as finding the extraordinary in the ordinary. And I learned this in a very real way from, as you know, over the years from the many people I've worked with in my practice. And again, something as simple as breathing is not a right, but a privilege. Connecting with your breath, filling your lungs, feeling that breath, feeling the ground under your feet, eating your favorite food, seeing the smile of someone you love, not overlooking those extraordinary moments in what could otherwise be deemed as an ordinary experience. It's also about finding the power in community. And when many people talk about feeling isolated, it means, where do you find your community? And yes, community can be a group of people living in the same place, can also be a group of people having a particular characteristic in common. Feeling of connection, a sharing of common attitudes, interests, and goals. I mentioned this as another highly recommended TED Talk from Dr. Kate Bowler, who was diagnosed with advanced cancer after giving birth to her son. She has a brilliant TED Talk entitled "Everything Happens for a Reason and Other Lies I've Loved." And I also highly recommend her podcast, talking about the power of connecting with stories. From Kate's TED Talk, she talks about the fact that I see the world as jolted by events that are wonderful and terrible, gorgeous and tragic. I can't reconcile the contradiction, except that I am beginning to believe that these opposites do not cancel each other out. Life is so beautiful and life is so hard. I strongly encourage you to take a look at Kate's talk. It's full of humility, full of incredible insight and compassion, and full of brilliant humor, much like her TED Talk and her podcast. I also want to mention the Canadian Cancer Society, finding the power in social connection, especially in the space of physical distancing. Telephone and online support is there to connect with someone else, whether you've been diagnosed with cancer or whether someone you love has been. There's an opportunity to connect by phone or online with someone who understands. These are trained volunteers who have the lived experience. There's also a cancer information line if you want to know more about treatment or resources. I encourage you to take a look at the Canadian Cancer Society online, as well as other accessible resources. And the Canadian Virtual Hospice is proudly Canadian, stated in the name, but it is the largest online repository of information supporting individuals and families of all ages facing complex illness. I simply highlight this part because they have a number of free resources offering grief support. And they're also looking to try and promote more accessible grief support. Now, all that to say, as we wrap up, I know the most important questions, as I read from Dr. Rachel Naomi Remen, a physician who's lived with complex illness her whole life. The most important questions don't seem to have ready answers, but the questions themselves have a healing power when they are shared. An answer is an invitation to stop thinking about something, to stop wondering. And life has no such stopping places. Life is a process whose every event is connected to the moment that just went by. An unanswered question is a fine traveling companion. It sharpens your eye for the road. So yes, I know there are more unanswered questions than answers, but I think all of that is about how we embrace those and look to go forward, looking for credible ways to connect to the people and places that are meaningful for us, and looking to connect to credible resources and supports that will be available for you, supportive for you as part of your experience. Anyway, all that to say is I do share a number of free resources across my social media platforms because, yes, social media can also be a source for good. So I simply wanted to share my information and turn it over to Vinitha.
Thank you so much, Elizabeth, for that wonderful, wonderful, insightful presentation. I know I myself and a lot of people found that very moving and very informative as well. So it looks like we can move on to the Q&A segment now. And I know we had one really important question. I think that it's very pertinent related to today's situations as well. So would you be able to speak directly to someone experiencing grief in this time of COVID? So I know for people, anyone who has unfortunately lost anyone, a loved one, memorial services are very difficult. It's all digital interactions with friends and family, and no family members can really congregate together to grieve in shared space. So would you be able to share anything or some insights on how you suggest that people, I guess, deal with their and address their grief during this time of COVID right now?
Yeah, thank you for sharing that question, Vinita, and thank you to whoever put that question forward. I know it's a common question a common concern right now, and certainly a universal loss for many. I know, again, there's no prescriptive way to respond to it, simply to say that it adds an added layer of loss, an added layer of complexity to an already profoundly life-changing loss. Having someone you love die is life-changing indeed. And then all of the rituals that can find ways that can be meaningful to connect with the people we love, to support one another through an experience like that, to be physically connected and to physically share those rituals together is suddenly challenged and changed in the face of COVID, as are funerals, whatever those processes and experiences look like for you before. I think it comes down to, first, acknowledgement that this is so hard. Acknowledging also, what is meaningful for you, and looking at, again, coming back to Brene Brown talking about vulnerability in the midst of all of this. Nobody wants to think about innovative ways to respond to loss and grief, but it really does mean looking at what are some new ways you might connect with people. Also acknowledging it's far from ideal and not at all what you would want at a time like this. But what can you do? Again, coming back to that quote from Arthur Ashe, use what you have and do what you can at this time. As I've already mentioned, there is no closure in grief. When someone we love dies, we grieve that person depending on our connection to them. And I know that looks different for everybody, but for the rest of our lives, for many of us. So grief is not time limited. And yes, right now in the midst of COVID, it means that grief and bereavement looks very different. Do what you can right now. Acknowledge that with the friends and family, the people you love. And look what you can do, again, virtually, whether it's telephone, text, online, whether it's creating something together, sharing something together, however you might be able to do that. It's about the power of connection, but it does indeed mean practicing in a way we've never had to before. And there's also layered loss and layered complexity with all of that. So like I said, I can offer more questions than answers. There's no easy answer, speaking to the depth of loss and the cumulative losses that are happening now with COVID, that when someone you love dies, you also lose the opportunity to connect in a way that you would have, or to practice the rituals in a way that you would have before. So it's acknowledging the depth of those losses as well.
Mm-hmm. Thank you for that. Looks like another question we have is, for someone who has found out that if their partner or loved one has been diagnosed with maybe a later state of cancer, for having that conversation with other people, if you don't know how people will react to the news, or if they are inquiring, or what do you tell friends so that they don't have to inquire every time, so they don't feel uncomfortable? Do you know how, I guess, would be a good approach to go about this?
Yeah, I think that's
If they should be bringing cancer into the conversation all of the time, or like the boundaries involved.
Yeah, I think that's a really great question. And thank you for asking that. Again, I think this is going to look different for everyone, because I've honestly met some people who didn't want to tell anybody, didn't want to tell their coworkers, didn't want to tell their extended family. Some people died having not told anyone that they had cancer, and said they had another condition instead. So I think it comes down to looking at the individual experience and the individual relationship. And if it's your partner or parent or sibling, whoever it might be, again, coming back to those 3 W's: wonder, worry, wish. I wonder what we can say to others. What would you like me to say to others? What words would you like me to use? Who would you like me to tell or not tell? Again, coming back to some of those boundaries. Because energy can be so depleted physically, mentally, emotionally, it can also mean, do you designate someone else to tell? Or do you send an email out saying, at this point in time, we're not in a position to respond to questions, but we really want to thank you for thinking of us. This might be what we need, or we'll reach out when we need more. So I think, again, it comes down to the unique experience of what words, what language do you use? I know some people choose to use language that others aren't comfortable with. Again, how you reach out, who you reach out to, and again, who you step away from is a big part of this. So my apologies, it's not a prescriptive answer, but I think it does mean having those informed conversations. Also recognizing that 2 partners, 2 spouses might have a very different approach to this as well. So that also can create additional tension. And again, how do you care for yourself? Who do you turn to in the midst of that as well, is an important part of that conversation. So I think I probably answered that question with more questions, but that's my response, Vanita.
Thank you for that. So it looks like we have time for just one more question before we wrap up. So what can you share about anticipatory grief with terminal illness for both the person and their family?
So that's a really important question. I thank you for asking that. The reason I mentioned loss and grief today is, again, because many people think that grief only begins when someone has died. And as I try to illuminate, albeit briefly today, well, I appreciate and I thank you for your patience for sticking through this. There are so many losses throughout an illness experience. And again, whether that's job loss or loss of, identity or intimacy, loss of social connections, all of those things happen throughout the experience. But for the family themselves or friends themselves, certainly anticipating that for someone whose cancer cannot be cured, that at some point this person will die. And again, where that family is on and exploring and expressing that looks different literally for every family I meet. Some are open to talking about that, open to creating legacies, open to collective discussions, communal discussions, whereas others say, I don't want to talk or tell anyone about this. The grief that someone you love is dying is very real. So I think, again, it comes back to the individual experience. Who within that family unit are you able to talk to? Again, coming back to the 3 W's. What are you wondering about? What are you worried about? And what are you wishing for? Making room for the loss and grief in the midst of that. And again, there are resources to support you in this. And I've only captured a few today. Turning to Canadian Virtual Hospice is also a wonderful place to access tools, conversation starters, hearing stories of others who've navigated that journey as well. So it's a very brief answer to a very big question, but an incredibly common concern. That grief and loss is so real. And it's often that elephant in the room that isn't named, that isn't identified, and that isn't spoken about. And it can certainly be very impactful that people carry that without naming it or acknowledging it. So acknowledging the loss and grieving the loss before someone dies, looking to make meaningful connections, even legacy, if that's possible to do that together, or, again, in unique ways for yourself. That's really important as you process the experience and go forward, however long that experience might be, whether you're talking years, months, weeks, days, or hours.
So thank you so much, Elizabeth, for taking the time to answer those questions with such depth and reflection. And I think with that, we're going to wrap up our presentation for today. But I just wanted to thank you, Elizabeth, on behalf of everyone who was able to join us today. And I just wanted to thank everyone who was able to participate in today's session. And we do hope that you did find it to be informative during this time. And there are a lot of other Be Well talks happening. I know Elizabeth is facilitating one on June 24th as well. And if you're interested in that one revolves around advanced care planning, demystifying essential conversations and resources. And we have other Be Well talks as well. So feel free to take a look on our website to see what resonates with you, to see what you're more curious about learning. And we hope that you do take care of yourselves during this time. And thank you so much again to everyone who's able to join us today. And thank you, Elizabeth, as well.
Thank you, everyone.
All right. Take care, everyone. Thank you so much again.